whole healthcare industry is going to change dramatically in the next couple of years.
To chronic disease management and the preventative aspect of care.
AI can now understand the key clinical concepts of what's being verbalized in healthcare.
Welcome to Cherry Live. I'm Dr. Jordan Valrath, physician, entrepreneur, and Chief Medical Officer for Cherry Health. We're talking about Canadian healthcare. Join us as we speak to innovators, industry leaders, and people working to drive the health system forward. We're talking to Shaneel Pathak. He's the co-founder and CEO of Zamplo. Shaneel's passion for health empowerment was born from his experience as a caregiver. He didn't accept the information chaos that patients were experiencing and became a citizen scientist to make health decisions better. From his journey, Shaneel co-founded Zamplo, a digital health platform focused around collecting patient data for research. The long-term vision is to create a person-centric, connected platform where you control the movement of your health data. As a first step, they're solving for the problem of acquiring health data from outside of the hospital system for researchers or to remote monitor patients from the hospital for their treatment follow-ups. He's an advocate for policy changes to ensure access to one's whole health data set and a speaker on the power of health data in your hands. Outside of the clinical context, Shaneel's happily married to Sarah, and they live here in Calgary locally with their schnoodle Zoe. Shaneel, thanks so much for joining us today. Appreciate it.
Thank you, Jordan.
So how did you get into the digital healthcare space in the first place? Tell us more about that clinical background.
Yeah, actually, it's ironic where life takes you. I was a management consultant, worked in Vancouver, putting in digital platforms, about 15 years ago, especially in the ER and cardiology. Really loved it in the sense that it served a purpose. You're close to your clients, and so fast forward to Calgary, moved to Calgary, and then as a family members, many family members were going through the healthcare system, and my parents just saw the challenge of basically coordinating care,
Yep.
and it's difficult. And so there's the one aspect of coordinating care, and as I mentioned before, is you always have to repeat your story, no matter if you're sick or not. You always have to repeat your story. And so my background is in computer engineering, and saw this consistent patterns that I saw through this journey of taking care of loved ones with chronic diseases. And from there, basically in my head, I could see these better processes and better data flows, and that's where Zamplo was born. It started off as a engagement tool for individuals, and that's where our origin story was. And soon after, we found that as people were using the platform, entering information that clinical research liked and were interested in the real world data that was generated. So we launched a sister app called Zamplo Research, which then allows you to, with consent, peer into the app and retrieve data, and we became a research tool. We launched in 2020, and then soon after, the same platform, there was interest from the clinicians who are doing research to use it as a tool for remote monitoring. It's what the story is. It's the same data provided to different stakeholders. So why don't we have one platform, and that's what Zamplo strives to do.
Very cool stuff. I mean, the importance of just the follow-up process and getting accurate data. I deal with this all the time, just dealing with mental health is my sector that I deal with clinically for patients. And it's so subjective on the day-to-day, right? Of like, how's your mental health going, right? And then so sometimes we use some of the validated tools, your PHQ-9 or your GAD-7, just to get a bit of an actual numerical score on things. But again, that's like, you can't continuously do these things with patients. That takes up half your visit. And so like getting better access to just data to manage treatments, to see the effectiveness of therapeutics, like it's incredibly important.
Yeah, it's I think data is the lifeblood of healthcare in one essence, and not only does it help general practitioners in clinic, the hospital, but also allied health. Often they're looking for similar information. And so we thought, well, there's also the challenge of recency bias. You go into clinic, that's when you tell the story. You may forget your questions, and so how do we better organize the patient and caregiver in order to make a better conversation? I think that's a win-win. No more time efficient, more to the point, and you could articulate a story. With Zamplo, you could articulate it as a graph, as a list of questions, or even a photo. So different modes provides different color to the situation, which I think helps everybody.
Is there a specific sector or subset of the healthcare demographic where the remote monitoring seems to make the biggest impact on the outcomes?
Hmm. It's actually, I wouldn't say it's a demographic from an individual standpoint. That's a good question. It's actually rural and remote healthcare. That's number one. Number two, I would say it's actually this is more subjective, but it's the healthcare of the caregiver. Because imagine, driving in, taking time off work for your loved one to attend appointments when you could do this remotely.
Like blood
But
pressure, or there's so many simple things that would just get sped right up
yeah,
by having a remote device.
yeah, it's just remote monitoring. I mean, it's more efficient for the individual, time savings, but also for the clinic, you could increase throughput without decreasing quality of care.
Mm-hmm. What specifically, in terms of data, gets used the most? I mean, is it blood pressure data? Is it blood sugar data?
Mm.
Is it mental? Like, where do you actually see
Mm.
the industry going in terms of that remote monitoring?
Yeah, with the remote monitoring is interesting. I mean, I think there's a big push for wearables
Yep.
because they're consumer devices now. But not all consumer device provides you with accurate measures that could be clinically valid. Um, but so wearables is one, but it's really from our perspective, it's a combination of wearables, validated surveys, so patient-reported outcome measures, and subjective measures. What are they feeling, and how are they doing? And it's those three that we want to combine. And I feel that remote monitoring typically falls in the bucket of remote sensors.
Mm-hmm.
If remote sensors could solve the problem, then physicians won't be asking humans questions. But they have to ask questions because there's a bigger picture at play, and that's what we want to provide the value towards.
When it comes to that actual wearable data, that continuous flow coming in, I'm picturing the Apple Watch being right at the focal point of all this. What else is actually going on in terms of the hardware? If you're trying to conduct a study, what other options do you have? I can picture having to come up with like bespoke hardware yourself for whatever variable you're trying to figure out. It's probably very difficult. So there's probably a lot that then comes back to, okay, what can we already tap into that's out there currently? And I'm just thinking of people's
Yeah.
smartwatches as being the center of all that.
Yeah, smartwatches are, I would say, the first anchor because you get your activity data, you get heart rate measures. Even some have O2 sensors. Um, but we're working with researchers at University of Alberta, and they're looking at um, cough measures, respiratory information. Um, there's now, I mean, I'm guessing over 1,000 um, types of sensors which you could connect to your body and retrieve data from.
Okay, so this is
So
already like widely available then. You can just find these sensors out there, and it's just a matter of connecting it and procuring a few of the sensors for your patients.
yes, but now those sensors are more provide more physical health.
Mm-hmm.
What you don't, especially when it comes to like the Age Well initiative and we have in Canada for seniors,
Yep.
is how do you collect consistent data? But those sensors, as I was saying, are more physical health. But when it comes to mental health, it's truly from direct from the individual to really report because for obvious reasons.
And then I can picture the biggest challenge there just being engagement with the patient, like the reminder to pop the app open, fill in the survey,
Mhm.
actually like click on the grading scale for how I'm feeling today. What's the trick to that? How do you actually get buy-in from the patient on that
Mm.
regular enough basis that it's clinically useful data?
Yeah, that's a tackle which I believe Zamplo has done a huge headway in solving. Um, what you find with a lot of systems is they're provided by a clinician. These gadgets. Then the data is sent to the clinician, and the individual doesn't receive anything. And so then the motivation goes down because you're not engaged in your health. You can't see the data. You're a data provider in essence.
Yeah.
With Zamplo, we have a mission that all the data that's provided to either clinical researchers or in clinic, you get to keep for life. You get to engage with it. You could invite your caregiver. You could share it with whomever you want in your care circle. And that's where we get the uptake. And so, like we have a great study happening at Princess Margaret. They show much higher engagement rate with the participants at 75% engagement rate with us versus the incumbent, which is around 24 to 46%. So why is that? Because often when you report, let's say, a prom survey, or you fill out your data, or you wear a watch, it's discrete measure. It's a single purpose, and it's directed to the clinician. But how about we say, let's flip it, let you engage all that information and then provide it with consent to the clinicians. And I think that's a win-win, and higher engagement is what we're seeing with our platform.
Well, that's definitely the crux of it, right? Because without the data, like, there's really no next steps. I mean, clinically, we use a secure email portal, and just looking, at the rate at which patients get the survey and fill it back and send it to you, it's abysmal. Like, that is that big hurdle you got to get over, is the actual patient engagement. And so approaching it from how do we make the data useful and visible to the patient so that they're keen on actually filling it in regularly? I mean, that's incredible.
Yeah, because like we have one project, one organization out of Airdrie, a thumbs up, thumbs up. They serve mental health patients or people with mental health challenges, and they use validated surveys. So here's a non-physician centric organization. They're using validated surveys. They complete them ad hoc where the individual sees a crisis, and then you start getting trend analysis and longitudinal data. Right? Versus, like as I mentioned, versus just filling out a proms at the time of your appointment, which I don't think is as valuable. So I think that's one of the key differences with Zamplo when it comes to remote monitoring. And we envision and that actually not only us, but Eric Topol, he wrote a book, The Patients Will See You Next. And he says that there's going to be more health data outside the healthcare system than in it in the future, just because of these devices that we're talking about.
Is there a way to gamify it a little bit, like taking a play out of the book of the social media apps and stuff like that, right? Like you get your hit of dopamine when somebody clicks the like on your workout data, or from Strava, or I'm trying to think of what other examples there are. Like my personal trainer has his own app, and if you like do something that's good, he'll click the like button on there. That sort of, I don't know, even these small little kind of goofy things help keep you engaged with it. Is that sort of, is there any element to the approach that you guys are taking that way?
Yeah, we that's in the roadmap. It's more of an art than a science to do that engagement. You need a more participants to understand the trend and what the triggers are. We have methods like, for example, a community where you could find individuals and talk one-on-one and find individuals who are exactly like you. That could be by your diagnosis, could be your therapy or medication, or even your symptoms. Because that's what people are trying to do. They're trying to find others who are exactly like them anywhere in the world. And that's what we offer. So those are the kind of the engagement features to make Zamplo sticky in respect to an individual. And once you make it sticky for the individual, then the remote monitoring or the clinical research space makes it becomes much easier because of the way we're approaching the challenge, is that you approach it from the outside in.
This show is brought to you by Cherry Health, Canada's medical network where healthcare practitioners connect. Physicians, pharmacists, nurses, chiropractors, and all other healthcare professionals can sign up for free, start connecting, messaging with colleagues, or checking out job opportunities posted by thousands of employers across Canada. With dozens of healthcare-specific job filters and search options, we make it easy to advance your career, Find your dream job or line up your next locum with hundreds of new jobs posted every week. www.cherry.health to get connected today. So just that pragmatic, make it useful from the patient's approach, as opposed to like the gold star trying to gamify it, the actual utility of it and extending it to them that way.
Yeah, because like most of our competitors, um, they're primarily clinical research tools, and I see ourselves as a patient-centered tool for clinical research. And that's the distinction between us and the common competitors that we see.
And so let's say somebody's putting together a project, they're doing some research. How do they actually interface with the Zamplo app, and how do they then get that set up with their patients? Like, do you need to know how to code, or is it got like an interface where you're actually just like setting it up within the GUI itself?
Yeah, good question. Good question, Jordan. Um, it's a software as a service. So we take care of all their hardware and all the software. All the data is encrypted, stored in Canada. Um, what happens is that we train a clinical researcher to on Zamplo Research, which is a research dashboard. They then configure it for a particular protocol. They and that could be for a clinical study. They invite individuals either by sending them an email or even giving them a postcard with a QR code. The individual then downloads Zamplo, gets the customized version per what the physician wants, starts recording their information. And then with e-consent, that data then is pushed back to the dashboard where it's visible and downloadable by the clinician. So we could set up a clinical research within a day. And that even goes, let's say, in clinic, if you want to use Zamplo for remote monitoring, it's very quick to set up. And I think the value proposition is that we take care of all the hardware and all the software and support for that service.
And then how does the patient actually interface with the data? Does it just display in a portal within the app there directly, or is the app more just for data capture and then they have to go somewhere else to actually view it or analyze it?
For the individuals, for the
Yeah.
participants, yeah, no, it's all embedded in our platform. So there is a tool. In essence, they record the information, they could analyze it and share it with whomever they want. And when I say that, I mean it's pretty straightforward with our e-consent module to share it back to the sponsoring clinical researcher. But there's you could create reports and graphs, email them or PDF them to whomever you want. And we did it that way because often you could go into, let's say, your primary care physician and have a conversation, engage them, but you're typically seeing other practitioners as well, who often is looking for the same information, or you become because of our healthcare system, you become the glue between the other practitioners, and you're the one who is the hub to exchange the information. Even with our EMR, you still have to do that. We're a long ways away of making this ubiquitous. And so what we've done is that, well, we know you're going to be the hub. We're not going to change that. So rather than taking paper notes and notes on your phone, we give you this platform to do that. But the value service is that basically you can engage in the data for yourself and also contribute to science, which is the clinical research. And I think this is important for Canada because there's like we're trending down in terms of clinical research volume and studies.
Why is that? You just kind of wait for America to do it and then ride the coattails back up?
Yeah, I know it's a good question. I mean, from my research in 2010, 6% of clinical trials were in Canada, and now it's about 3%. 3% participate in clinical studies versus like the UK, it's 14%. And so, one is the optics of clinical research. Is it? There's also the barrier. Sometimes some of the friction when I say is the optics of clinical research is it a last resort? What are the risks? And so, for example, in Zamplo, you have a health library where you give all this information on the research that you're participating in, so they have it handy with them. The other area which is a friction is is the travel and the time constraints, especially when it comes to our geography. And Australia has done a great job in terms of decentralized clinical studies. And so we know, like I know that especially in cancer, they're moving to that direction in Canada as decentralized in order to increase the participants. And as a country, this is important because the countries that produce more clinical research, I mean, there's an economic benefit from it, but there's also global influence. I believe UK, with that amount of participation, has a very big influence on global policies because they're producing the data and the studies. And so I think Canada has a huge opportunity to move up in that space, and we love to contribute to that.
Do you think like the pandemic and just the push towards remote and phone-based and telehealth interactions impacted those numbers at all?
Um, well, yes. So I think the pandemic was a wake-up call to the classic way of doing clinical research, and I would say clinical care. And Jordan, I mean, you know more about the
Oh, I
challenges.
live on the internet now. My whole
Oh,
practice has gone digital since right around, March 2020.
yeah, yeah, and I think my controversial statement is that the benefits of the pandemic is that there's practitioners who are more comfortable going digital, like yourself. At the same time, people are more comfortable getting online support and consults. Um, there's a big change from the pandemic, I think, when it came to the compensation model. And I face this in our remote monitoring implementation in clinics, like in hospitals. Because if the payment structure is by person and they have to physically see the person, then you're basically constraining innovation. And I think that's slowly changing, but that needs to change where in certain circumstances, remote monitoring not only can provide the equal or better care, it improves throughput. I think, I think I mean, no need to convince you, Jordan, but I think that pandemic has really shifted the mindset of Canadians when it comes to remote monitoring and telehealth and
Well,
accepting it.
yeah, there might just be a bit of a misalignment of incentives, right? Because the throughput definitely has the potential to go up, but then, does the incentives behind it on both sides actually follow that?
Yeah, I think not too familiar with the incentive structure, but I do respect that it has to be aligned with the capabilities and the services provided. But I mean, given the United States has remote monitoring, there's a billing codes for remote monitoring, and it's pretty standard. But I think one of the big differences between the U.S. and Europe and Canada is actually on uh, democratization of the data. So, and this leads into technology adoption to remote monitoring and also accelerating clinical research, I believe. And so, with the U.S. CARES Act, it really pushes that data outside those EMRs into the hands of patients, or creates that fluidness of the data. Europe is also moving in that direction with Article 20, and sadly, we don't have um, that type of legislation yet in Canada, and that's one thing I advocate for. But I know in the EU, they're basically European health data space is empowering individuals to having rights over their health data and port it from provider to provider. And this will not be done through the EMR vendors. There is a interest to keeping the data with themselves, and this is where I think policy and legislation has to change. And I think by doing so, we will see more uptick in digital health technologies because you have that data flow being enabled.
Well, the EMR itself is definitely arguably one of the stickiest products that healthcare providers will ever deal with, right? Like there's a huge barrier to actually switching. And so the EMR
Yes.
providers, I think they know, they've kind of gotcha. They've got a captive
Yeah.
audience, right? And so if things are deficient, there's not a whole lot of incentive. They know you're not switching it up and going anywhere. I mean, when you say democratization of the data, what do you mean by that? Because like my understanding was that patients, it's their chart. I'm sort of just hanging on to it in the meantime. What does that actually imply?
To me, well, democratization of data is twofold. I think one is it was really focused on de-identified data and making that available, right? So let's focus on that de-identified data. Now, when I look at democratizing data, um, everybody from AI researchers um, to researchers in academic institutions and also private organization, can they, with consent, get access to this de-identified data? Or even identified data, again with consent. But at the core of the issue, I think, is if we flip the model and have the individual own and control the data set, then they consent, and then that solves the challenges with the regulation in terms of how do you release this data. But so democratizing data is that it should be freer than it is today. And as you mentioned, I mean, the EMR vendors know that data is what holds clinics with them.
I guess the other side of that would be how much data never quite hits the light of day just because it wasn't in favor of the research study, so it never winds up getting published. Like, would you be in support of having a central study registration where before the study is conducted, they gotta register it, and then no matter what, upload the data, and you got to follow through on it, so you're not cherry picking the favorable ones depending on what outcome you're looking for?
That's I think a dream to liberalize that data so we can analyze it, and not only and I think that's a dream. Will we get there? I think it'll be a long time in getting that
One day.
shift in culture one day. But what we're seeing now in clinical research is there's a new player on board, and that is patient organizations. They are funding clinical research. They have a cohort of people which is focused, and it could capture that data and organize that event. And when I talk to patient organizations, um, they're very much for the liberating that data because their sole purpose is the advanced clinical research for that particular condition. And I think that also adds and it may accelerate this vision that we're talking about, Jordan.
Is there any particular facet of the healthcare data that you see as being higher needs, or stepping back from the industry trends? Is there a direction you'd like to see things progress in?
Hmm. When
Where
it
do we
comes
have
to
the most
data,
potential with this kind of thing?
um, not a specific type of data. I think it's the merger of physical health and mental health data combined. And the reason is it's so siloed. I think our healthcare system, by the nature, if you follow the money, it goes by province to specialty or to service provider, and then to geographic region, and then there's where your data is. And typically, what we found is there's people who are diagnosed even with, let's say, cancer or MS, and depression and mental health challenges are synonymous. But when you silo the data and silo the service, you silo the data, and then you don't get a complete picture, and that actually is not really effective healthcare. This is where I think what we have is a sick care system because of the design, the basically the financial structure of our healthcare, and then second, the data structure of our healthcare leans towards more of a sick care system than a healthcare system. And the likes of Netherlands and other countries, you see how they're really acknowledging that and changing it.
What are they doing differently?
Um, in Netherlands, they're coming up with almost like a data bus, and so they allow private companies as well as other players to authenticate into the system and then pull the data with consent. My analogy is like Revenue Canada, right? You could log into the CRA website, or you could use a private third-party tax software to authenticate and log in and pull that data, and it's your choice. If we could do it for taxes, why can't we do it for healthcare? And that's what part of it is liberating the data. But in Netherlands, it's digital health is um, embedding digital health and digital care. I believe is far higher than Canada. Sadly, as part of the stats of digital health implementation, like a global stat, we are 23. We were used to be 17 in 2021, so we're dropping, unfortunately. So there's a mix of challenges of why that's happening, but um, yeah, Europe is ahead from policy standpoint in adoption.
I mean, that central aggregate of the data, that sounds like an incredible opportunity, but at the same time, the Achilles heel of it being just the privacy and the security risks that comes along with it. But that certainly would be like an incredible accomplishment if we got to that point where things were centralized that way.
Yeah, I think there's always a privacy and security risk, and that's with everything, and that will never go away. So I think the question then is weigh the pros and cons. Does because I feel I've seen in my time as an advocate is different actors put up the privacy risk flag of why they can't share the data, right? And I'm saying, well, what is the clinical risk of not sharing the data? And I believe that outweighs the privacy risk, given where we are with technology and encryption technology, etc. And so I'm for the sharing of the data in a structured format, because it'll lead to better care. And I believe if we look at the quadruple aim and practitioners and practitioner burnout, like I imagine that if you could get your whole, a person's whole health information, then you could provide get a complete picture. Would that be more satisfying for for the duties that you take?
Yeah, I guess when you look at it from that holistic perspective, what's the opportunity cost at the
Yeah.
systems level of not doing it, right? Like when it
Hmm.
comes to cancer care and genetics, like all these different conditions that sort of play together with the actual individual's health data, right? Like what's going on in their life on the day-to-day
Yeah.
basis.
Yeah. Yeah. And I think, um, I mean, privacy has to be respected. Um, that framework has to be put into place in policy and structures in place legally. But I think it's gone to the point where the pendulum is tipped, where privacy becomes a reason for not to act. And I think Alberta in particular is looking at changing that, and I think Europe and the United States is quite forward thinking in that respect.
Is there anything that needs to be done just from like the Canadians' systems perspective to make us more amenable to having better data sharing?
Uh, yeah, I think it's putting legislation. So I'm an advocate, and I focus on the power of health data in people's hands. I co-authored the Personal Health Data Rights of Canada, which we had it signed by 35 health organizations, and that declaration is non-binding, but it all anchors on this 1982 Supreme Court decision saying that the individual owns the data. Like Jordan, what we talked about in the beginning, it's the individual's data, but we know 9/10 of the law is possession, and is not necessarily easily accessible. And to make that accessible, we need to mirror legislation from what I was mentioning in the US CARES Act, or in Europe, where it's forcing um, these variety of stakeholders to say, no, your duty is to provide the data to the individual. Um, and you have to do that proactively. That's what I would like to see.
Getting more data in the first place and then just using it better. 10 years from now, where do you see Zamplo, I guess, if we were to extrapolate things out into the future and things go perfectly accordingly to plan, government incentives align, where do you see things actually going?
So we want to be um, the platform for an individual's data, resources, and a community. So what we feel is that we become the platform for that data exchange between the individual and then any stakeholder they deem important in their healthcare journey, anywhere in the world. So we want to flip that model. Individual gets to own and control that data, and share it with whomever they want in order to get the best care that they deserve.
Do you see that? Sorry, go ahead.
Sorry?
Go
I was
ahead.
going to say the first step. Now that's the heavy lift, but the first step is what we've been talking about is what's our path to success, and let's get into clinical research because it validates our platform. If the data is good for clinical research, it's good for clinical care in terms of the quality of the data. Then let's move into clinical care for remote monitoring. But as we build the platform out, what we do is that the individual gets to own and keep their data, and then you get a critical mass, and then that's when it flips, and that's our vision.
And getting to that point, what needs to happen? How much adoption and utilization of tools like this do we still have to do? Like, are we pretty far away from that goal, or are we like inching closer towards it?
In Canada, we're further away than other countries because, as I mentioned, the barriers for adoption is actually not the technology. I think the technology is there. We talked about the financial compensation model, cultural change with trust, with online data versus physical engagement, and so I think we're about 10 years away, and I would say sadly, as the crisis in the healthcare system deepens, that vision becomes closer because we have to change. Because in order to provide the care that we need across Canada in rural and remote areas and urban, digital is the way to go. And as the crisis deepens, the shift in culture increases. It's sadly inversely proportional.
I mean, we saw it with just general primary care, right? Like way out in the rural, remote parts of the country, they've been doing telehealth for years and years and years, right? But like it wasn't until the pandemic really squeezed things that came to the forefront of, urban care. And so it's sad, but it's the more pressure and the more constraint that the system faces, just the higher that degree of attention to change and becoming early adopters and going a different way with our technology.
Yeah. It's so I think it's policy and culture, and they're changing. But those are the two catalysts to get the dream that we've been talking about, Jordan.
So if somebody's out there and they're looking to, remote monitor their patients better, let's say physicians got a telehealth practice, or let's say they fly in, fly out of a community on an occasional basis, how do they actually get things set up through the platform and to their patients?
Yeah, well, they could come to our website, www.zamplo.org, contact us. What we usually do is we have a half-hour call to understand what their needs are, typically what the scenario is, be it in clinic or in research. We demo our platform. We can do this very quickly. And what we want to do is make sure that we could satisfy your workflow and your requirements. And then it's really a commercial agreement, and then deployment could happen very quickly. I would say within weeks, being a SaaS solution. I think the one thing I would like to highlight with us is that if you want, when it comes to remote monitoring, if you just want, let's say, patient experience data, or even wearable data, there's other avenues than us. If you truly want to make the individual engaged in their health, self-sufficient, while collecting data and providing them with knowledge, in essence, making the patient a partner, then that's our platform. That's what we value, and we're always looking for collaborators in that space.
And then you mentioned earlier, there's actually like reimbursement billing codes and things available for remote monitoring. Does that make it way more financially viable for your average clinician?
I was referring to the US because I know they have those billing codes for remote monitoring. In Canada, I think it's jurisdiction specific, and I can't not as knowledgeable in terms of specific jurisdictions to comment on what those codes are and how that would.
So let's say I'm a clinical researcher then looking to get a decentralized study off the ground. How does the process actually work then? How do we start engaging that?
Yeah. So typically, we would review your protocol or the study objectives. Um, then we would like to do is do a walkthrough, like in essence, a demo. And so you see in your workflow and in your workflow how Zamplo would work. And then we go through the whole lifestyle. We set it up for your protocol, which is very quick. We do show you the sample surveys or the data entry, and then how it's displayed on Zamplo Research and what you could export. Typically, people export it to REDCap and use that as a statistical tool. So that is a very short exercise to show you how Zamplo would work. And basically, we've essence done the setup for you, but we then formalize it, the arrangements, provide the training, and then provide you documentation for ethics submission. But in essence, you're ready to go. And that model also works for remote monitoring because it's the same platform. The only difference we find when it comes to patient-centered data collection for clinical research versus clinical care is the time period. You could do it in near real time for clinical care, or you could do it periodic based on your protocol. And that's why we could serve both markets.
Do you guys help at all in terms of like a consulting role? Because there's a lot of budding researcher clinicians out there. I know, especially for the College of Family Physicians of Canada, there's a few new things on our licensing requirements and our credits that we have to actually accrue, which now are pushing clinicians more towards this direction. And I don't think a lot of people are super familiar with the process. Is that something you guys actually help out with as well?
Yes. So we're in essence full service. We could help you write your protocol, do the ethics submission, because we have clinical researchers on our staff.
Cool.
Then what we do is we typically set up Zamplo for you and then train you so you're self-sufficient using the platform. Because what we find is sometimes you might want to tweak a survey, adjust your protocol, and then you're self-sufficient to do that. Or even add education material. You could do that. We provide you with the support and you journey through. So we're very keen on new investigators and also people who are first going into clinical research, because we have that support that we could provide, not only from the technology platform, but the service as well.
Very cool. Yeah, no, as my QI credits come due shortly here, I'll be sure to reach back out to you guys. For
sure. Love to work with you, Jordan, and also for the audience of our podcast. Love to be engaged, and we want to grow with you and make healthcare in Canada equal and better than what we see in other countries like Europe.
A very noble endeavor.
Thanks, Jordan.
So final question, what is your personal routine for wellness? What's your secret to looking so young?
That's good. Good question. So, well, one is what I take in. So, very clean water. I start off the day in the morning with meditation, a short meditation exercise. I drink lemon water every day. I just drink a glass of lemon water. That's what I start off with. Go for a walk with my dog. Then I come back and have my breakfast and start work. And my evenings are typically either cycling or going for a walk with my wife Sarah and Zoe, our dog. But so in essence, it's a lot of nature. A lot of nature is key. And then clean eating, clean water.
Amazing. All right, Shaneel Pathak, thank you so much for joining us today. Really appreciate it.
Thank you very much. Much appreciated.
Take care.
Take care. Bye-bye.